A warm good evening and welcome to all the participants for taking your time on a Sunday evening and joining us for this Silver Jubilee online quiz Capsule 2. So many of us would have already joined us in Capsule 1. So now we are going for Capsule 2. For Capsule 1, we had the theme of by the yours, for the yours. For Capsule 2, we have the theme of donate eyes, save lives, as we are currently going through the eye donation fortnight. So the quiz is organized by Team Mahathma. So myself, I'm Dr. Prasanna Venkatesh Ramesh and Dr. Shruti Vaishali. So we both are from Team Mahathma, where we are organizing this along with the quiz master, most vibrant and dynamic Dr. Niranjan Karthik, who is a fellow and a young, brilliant quizzer from who's doing his current comprehensive fellowship from Dr. Nirmal Frederick sir, and Dr. Varsha is also part of the Mahatma family. So they both will be the quiz masters for today, and the quiz masters' decision will stay final. Please do ask your questions before the quiz, and even if in between also, please do ask. We'll try to help you out as much as possible. So this goes with the team of Donate Eyes, Save Lives, as we just are going through the eye donation fortnight. So we have three prizes for the top three. Not only that, the novel concept of this quiz is we have 25 winners. Since we are celebrating the Silver Jubilee, we thought we have 25 years of celebration with 25 winners. So if you are not in the top three also, if you are in the top 25, you walk away with a cash prize of at least rupees 500. So with that, I hand the session to Dr. Varsha to introduce her fellow quiz master and take the program from there onwards. Yes, over to you, Dr. Varsha.
Hello everyone, I'm Dr. Varsha. So I'll be talking about Dr. Niranjan Karthik, who is the quiz master of today's MEH Silver Jubilee Quiz Capsule 2. He is a postgraduate from the prestigious 200-year-old RAOGH MMC Chennai, currently pursuing comprehensive ophthalmology fellowship at Minimal's Eye Hospital, Tambaram, TMA Pi Gold Medalist at UG for Best Outgoing Student of the Batch, topper of the batch 2022 in PG University exams at RAOGH Chennai. Quiz awards are top 3 in HK Tiwari Gold Medal Quiz 2020, top 3 in Selvan Quiz at TNOA, top 10 in AIOS ARC Quiz at AIOC 2023, first place in state level and regional quizzes, presented papers at state and national level conferences, and published 10 plus articles in peer-reviewed state and regional journals. So I welcome you, Dr. Niranjan Karthik. Definitely Dr. Prasanna sir needs no introduction. He is a vibrant and jubilant host of organizer of this quiz. He is glaucoma and research medical officer at Mahathma Eye Hospital Limited, Trichy. Published 96 articles, including 46 articles in IJO, glaucoma section editor in TNOA Journal, management committee member TNOA, executive member YOSI, chief instructor at ASCRS 2022, GSI 2021, AIOS 2021, AIOS 2020, and TNOA 2019. Recipient of various awards in World Glaucoma Congress and AIOS, GSI, TNOA, and DOS. So, welcome, sir. Can we start with the quiz, sir?
Sir, you're mute.
Thank you, Dr. Varsha, for the kind introduction. And I also like to introduce yourself, Dr. Varsha, who's a glaucoma fellow of Mahathma Hospital Private Limited, who's a young and vibrant surgeon and a researcher. Along with her, I also welcome Dr. Shruti. You can just show your hands, Dr. Shruti.
Yeah, over here.
She is currently pursuing her FRCO Ophthalm, and she's also part of the MEH family, and she has more than 50 plus publications in PubMed Index journals, and she's a FICO awardee as well. So we have a good team with us, and the theme is Donate Eyes, Save Lives is the team for this event. And I hand over the session to Dr. Niranjan and Dr. Varsha. Please take the participants once again through the process of quizzing. And once we have taken through them and the session is all yours, please start it. And we look forward to have a wonderful event with you. And let's all enjoy the questions asked to one another.
Having a little bit of a difficulty logging in. So I'm just, for all the participants, I'm again sharing the Slido link on WhatsApp group. Please press on that from your mobiles to be able to log in. And if you're still having any issues, please post back on the group as well as here. We have Mr. Sai sir to sort it out for us. And secondly, I'll just go through the quiz rules once again for all those who joined a little late. So again, this quiz is going to be consisting of 40 questions. All of them are going to be single best answers, no negative marking. So please attempt at every question. Every question will have a time-based limit. And the time-based limit is usually 20 seconds for all the questions. And you have to choose the right answer. You have an option to change your answer within the 20 seconds and relock it. So that is an option that but whatever is considered, whatever is chosen at the end is considered as your final option, right? And you have to press the button submit to be locking your answer. Please do not miss out on that. There are no negative markings once again. And apart from that, if you have any doubts, queries, please ask now. We are going to start with the question number 1. Anybody has any questions, doubts?
Yeah, I think before we start, we just give them a minute time to just get back to us if there is any glitch. And
Yes,
our chairman has just joined, Dr. Ramesh Rajashekharan, Mahathma Hospital. He can have a few words for the 50 plus participants who are here with us today. 77 is the number. I think you can just address the gathering and we'll take it forward, Dr. Rajashekharan, sir. Unmute, you have to unmute yourself. So he's not able to unmute. Okay. Sai sir, can you unmute?
Done. He can unmute now.
Yeah, Ramesh sir, you have to unmute to actually speak. You're on mute.
Now he's unmuted.
Yeah, it just was. Otherwise, the host was blocking it. No problem. Yeah, really. I was just in a travel, so it's nice to hear from youngsters. Like I think we had I think this time the participation is better than the first time, and it's nice to hear younger generation coming up to the great expectations, academic fees, and I'll also love to be till the end, and I'll just not spend much time into your show. Once you are get ready with the thing, you can always inform me. Because a lot of specialties and a lot of academic interest is now developing into ophthalmology. It's beyond clinics and surgery. We need to be more vigilant ophthalmologist, and these sort of programs, close-knit programs, will give more information than attending into broader conferences where things get diluted. So I really appreciate the effort taken by Mahathma team, younger team, and scientific team to live up to the expectations. And I wish all the participants good luck. And participation itself is a good spirit. So whoever wins, it's really great for them to do it also. Over to you, the admin team.
Thank you, sir. Thank you. And I think we are ready and up and running. So Dr. Varsha and Dr. Niranjan, the stage is all yours. Set the ball rolling. Yeah.
Yes. Yes. So we'll start off with a quiz.
Yeah, please. Participants, hope you're all ready. We are going to go with the first question. Yes.
So question number 1. What is the most likely cause of allergic conjunctivitis in a glaucoma patient? List in order of probability. 1. Latanoprost, 2. Dorzolamide, and 3. Brimonidine. And your time starts now.
So I think we all need to know the common complications or side effects of drugs that we're using.
Yeah,
And
definitely.
yeah, it's a pretty simple question, Dr. Varsha. I hope everyone gets it right.
So last 3 seconds, everyone. And your time is up. So
the time is for 20 seconds, right? Is it Dr. Varsha?
Yes, sir. Yes, sir. So the answer is B. Brimonidine usually tops the list of patients who develop allergic conjunctivitis with, and we have seen quite a few patients in OPD as well. So following brimonidine will be dorzolamide, and then following that will be latanoprost. So brimonidine always tops the list. So going to next question. Question number 2. A patient is tested on Humphrey automated perimeter. The machine projects a light at his blind spot, and the patient presses the button. What does this patient's response represent? A, false positive response, B, fixation loss, C, short-term fluctuation, and D, false negative response. So your time starts now.
It's very important that we know about the reliability indices for any visual field.
Yes.
So it's a simple question, but I think, yeah, most people will get it right.
Yeah.
The basic part about reading a visual field again is the false positive, false negative, fixation loss. Sometimes we tend to jump into
What is presented to us?
what is the
To
confusion?
Yes.
I request Dr. Steffi to not answer on the WhatsApp or Zoom platform. We have a completely different platform to log in and participate. I request all the participants to kindly not prompt or answer anything on the chat box except for your doubts and queries. And doubts regarding technical issues and things, please do not mention anything regarding any of the questions on the Zoom platform chat. Thank you. So
You can also guide once again before we move to the next question. Just let her know, so she can join.
So Dr. Steffi, we have posted the link. Mr. Sai has posted the link saying quiz.urbanedge on the chat box. Please press on to that from your second link and second device, and kindly log in using your credentials and join the quiz where you will be able to choose the answers. So please do not post or anything on the chat box regarding the answers.
Okay, Dr. Varsha, we'll go to the answer.
Yeah, the answer for this question is it's a B, fixation loss. So fixation loss basically occurs when the patient responds as if he's seeing a light when target is displayed at his blind spot. So it is quite straightforward, this question is. So we always have to look for the reliability indices when we are checking the visual field of a patient. So moving on to the next question. Question number 3, a 65-year-old ex-CEO of a company underwent sequential uncomplicated cataract surgery in both eyes 1 month ago with implantation of diffractive multifocal IOLs in both eyes. His uncorrected visual acuity is 20/20 both eyes, but he complains of increased glare and halos at night with a Vaseline-like vision that fluctuates during the day. On examination, he is noted to have 1+ meibomian gland incipation and increased tear breakup time and a clear cornea with a well-healed temporal incision both eyes. The multifocal IOLs are both well-centered in the round pupil, and retinal examination is unremarkable. So the least useful step would be A, obtain a corneal wavefront analysis, B, perform Lysamine green or rose Bengal testing, C, perform manifest refraction, and D, measure scotopic pupil size. And your time starts now.
I request all the participants to carefully understand the question. It is least useful next step. So please answer accordingly. So these questions that are going to follow are expected to be of this kind. So kindly find out what exactly is being asked and then answer accordingly.
Another very important feature of this question, as Varsha is pointing out, I think you can let me know once the time is out.
Yes.
This is a very practical scenario. Yeah, time is out. It's a practical scenario where somebody walks in, you place a multifocal, he's a ex-CEO, you think everything has gone well with the surgery, very well done surgery, but then in the post-op day, he comes and gives you a nightmare. So we want you to take away something which is very important in your practice when you upgrade to a premium IOL. So that's the reason for this question, if I'm not wrong, Dr.
Yes,
Varsha.
yes, definitely. So the answer for this question will be A. So what I had asked was the least useful step for this patient. That will be obtain a corneal wavefront analysis. Of course, it will be helpful to quantify the amount of higher order aberrations, but that will not be the first step when the patient walks in. We have to obviously rule out other causes before jumping into higher order aberrations and checking for that. So, and dry eye also should be analyzed before going in for multifocal IOL. So that is a take-home point from this question. So moving into the next question. Question number 4. A 60-year-old man successfully undergoes phacoemulsification of a nucleus sclerotic cataract in his right eye. The surgeon accidentally leaves a moderate amount of viscoelastic in his eye. How long after completion of the case might the patient experience a significant spike in IOP? The options are A, 30 minutes, B, 4 hours, C, 10 hours, and D, 24 hours. And the time starts now.
I think another very practical question. Sometimes we all tend to make this mistake of leaving that excess amount of visco in the eye, and there seems to be a post-op IOP spike. So we wanted to keep it as practical as possible, and Varsha and Niranjan have done a great job, I should say.
Especially new surgeons when they're operating and post-operatively when they see corneal edema and the patient might be vomiting. So they always have to think of viscoelastic being the culprit. So the time is up. So the answer for this question is 4 hours. So Lane and colleagues, they had evaluated the IOP elevation post-operatively after using OVDs. And they found that mostly 4 hours plus or minus 1 hour post-operatively, there was a significant IOP elevation. So please do keep this in mind when we operate and then post-operatively when we evaluate the patients as well. So next question. Question number 5. All of the following are true regarding the condition shown in figure, except A, 50% of patients develop glaucoma. B, patients with this condition are found to have mutations in PITX2 and FOXC1. C, systemic abnormalities including redundant periumbilical skin and hypospadias can be present. And D, it is autosomal recessive inheritance is the most common one. And your time starts now.
So first we need to get the diagnosis for this.
First, yes.
That's pretty simple. I think people will answer.
Sometimes I choose to disagree with you, Dr. Shruti.
The last 3 seconds and your time is up. So the answer to this question is D, autosomal recessive inheritance is the most common one. So obviously this patient shown is axon-filled regular syndrome, and it is a autosomal dominant condition. It is not an autosomal recessive condition. So that is the answer. It is associated with PITX2 and FOXC1 genes, and 50 to 60% of patients will definitely develop glaucoma. Okay. So the next question number 6. A 68-year-old man developed a sudden onset of vomiting, imbalance, and double vision. On examination, he had a concomitant 10 prism diopter left hypotropia and ataxia. What test should be ordered? A, cerebral arteriography, B, cerebral MRI and arteriography, C, tensilon test, and D, carotid ultrasonography. And your time starts now.
So I think people need to know what test needs to be done to analyze the brain matter as well as the, I mean, if I tell it, give you the answer basically. So, but yeah, based on the type of lesion where you're going to do the scan, it's very important, neuro-ophthalmic based.
Yes, ma'am. All right, your time is up. So the answer is B, cerebral MRI and arteriography. The patient definitely he presents with ventrobasilar insufficiency. So cerebral MRI and MRA would be the best test initially to be done, and following which maybe we can go in for cerebral arteriography. And tensilon test will be appropriate if just the ocular malalignment was there. Like obviously this patient presents with other symptoms as well. So we'll definitely have to rule out vertebrobasilar insufficiency first. All right, moving to the next question. Question number 7. Supranuclear vertical gaze abnormalities can be seen in all of the following conditions, except A, myasthenia, B, Parkinson disease, C, pineal region tumors, and D, ataxia telangiectasia. And your time starts now.
It's a nice question. Basically, you need to know about the pathophysiology of each disease. Yeah.
Yes. Last 3 seconds. Okay. All right. So the answer for this question is A, it's myasthenia gravis. Obviously, myasthenia gravis might produce ophthalmoplegia that mimics the supranuclear vertical gaze abnormalities, but the pathophysiology is entirely different. It's at ACH receptor, so that has to be taken into consideration. All right. So the next question. Okay, this is mostly clinical. Look, question number 8. Looking through the inferior prism of a Zeiss 4-mirror gonio lens, you see the following in the slit lamp figure. So where is the foreign body located in the trabecular meshwork? Options are A, 11 o'clock, B, 1 o'clock, C, 7 o'clock, and D, 5 o'clock.
I think
And
this
the
is
time starts.
a pretty very straightforward question. Varsha has been very lenient for all the participants attending. A short Sunday favor, if I'm not wrong.
I just wanted them to feel comfortable, sir.
Yeah, I agree. It's a fun quiz. We want to label it as a fun quiz, and this is something again we always emphasize on something being very clinical, because these are things that we see in our day-to-day practice. Like when we draw a gonioscopy picture, after we see the patient, we need to orient the cognitive mapping in the mind so that even not only for a foreign body, for a peripheral anterior synechiae as well, we'll have to draw it accordingly. So a very valid one.
Yes. All right, we'll go to the answer. So the answer is A, 11 o'clock. So when you're looking through the gonio lens, there will be a reversal of superior and inferior, but there is no left and right reversal. So the answer is A, 11 o'clock. We'll move on to the next question. Question number 9. How many degrees is the fovea displaced from the optic nerve? The options are A, 15 degrees, B, 23 degrees, C, 10 degrees, and D, 6 degrees. And your time starts now.
And though the question may seem easy, my dear participants, the fast fingers, it really matters, because the sooner you answer, the more possibilities and probabilities are there for you to be higher on the leaderboard. So if you know the answer correctly, I think you should make sure you do the answering very quickly so that you can have the much better position on the leaderboard.
Yes. So your time is up. The answer to this question is A, 15 degrees. So this will help when locating the blind spot on the visual fields. So please take this into consideration. All right. So next question. Question number 10. What is the diameter of retinal vein as it crosses the edge of the optic nerve head? A, 80 micrometer, B, 120 micrometer, C, 160 micrometer, and D, 200 micrometer. And your time starts now.
This question kind of helps us. If you know the diameter of the optic nerve head region, you will be able to compare several pathologies also. So,
The lesions and yes.
Yeah.
Especially for the drusen, if I'm not wrong.
Exactly.
Yes, sir.
And one more thing, Dr. Varsha, after this question, Dr. Sai has prepared a leaderboard. We are almost 25% completed. So we'll just quickly see who's on the top 3 as of 10 questions. And after this question.
Yes. So the answer for this question is B, 120 microns. So this will help in evaluating the different retinal lesions when you are for it.
You hold on. Don't need to go. Yeah, hold on.
Okay.
Sai sir, do you have the leaderboard with us? We are almost through. We started on time and we had 10 questions through. You can show the leaderboard, and we would like to show a hi to the top 3 who are there as of now.
Yeah, the leaderboard is displayed on everybody's mobile.
Yes.
You can see and top 3 I can just list out. I mean,
please.
The third is one Dr. Ravi Chandna.
Ravi Chandna, are you there? You can just unmute and you can. Varsha, don't.
Yes.
Is Ravi Chandra there, Doctor? Yeah, you can just show a hi to us. Yeah, hi, Doctor. Great going. Hopefully, we'll meet you at the end also. Yeah, thank you. Sai sir, can you have
the second is Dr. Pankaj Kumar.
Pankaj, are you there? Yeah. Hello, Dr. Pankaj.
Yeah, hi sir.
Hi. So I think Pankaj is part of our previous capsule as well. So we hope to meet you at the end also, Dr. Pankaj. Good luck.
And as of now, Dr. Alice Thomas is stopping.
Okay. Dr. Alice, are you there?
Yes, sir.
Yes. Congrats to you once again. And there are 30 more questions to go. So it was nice to meet you 3 at the end of the 25% or 1/4 of the quiz. So again, we'll go for the next question. Over to you, Varsha.
Yes. So moving on to the 11th question. A 34-year-old female patient presents with worsening vision in her left eye. Fundus examination shows an epiretinal membrane causing macular pucker. A pinkish mass with surrounding subretinal exudation is seen within the infratemporal quadrant. Which of the following is the most likely diagnosis? A. Amelanotic choroidal melanoma. B. Intermediate uveitis. C. Retinal cavernous hemangioma. And D. vasoproliferative tumor. And your time starts now.
Another interesting thing is they're very neck to neck, sir, in the top 5. It's just a matter of few seconds and maybe a question. That's all. So I think it's going neck
It's
to
all
neck.
all a friendly banter, and each one of them is competing with the other to get into the top 5 or top 25, whatever like you would like to call it.
All right. So we'll see the answer for this question. So the answer is D. These are vasoproliferative tumors, and usually they are present in the infratemporal quadrant, and they cause abnormalities of the macula, including ERM and the cystoid macular edema. So that is it. So moving on to the next question. Question number 12. A 3-month-old infant presents with nystagmus and photophobia. Anterior segment and fundus photos are shown. All of the following statements regarding this condition are true except A. Both familial and sporadic cases have been reported. B. Visual acuity is typically 20/100 or worse. C. It is associated with corneal canis. And D. The familial form of this condition is associated with nephroblastoma. Your time starts now.
I think a lot of people are answering majority of the questions correctly. They're all Dr. Varsha's questioning.
I wanted
Varsha has secretly leaked the question paper.
That also.
All right. These are very simple questions that I have taken, sir. So
No, simple is the
Good.
tough one, is what I would say, because in the
Definitely.
clinics, these are the things that really matters a lot when we sit with this kind of a scenario, which is what that really matters at the end of the day.
yes. Sir. All right. So time is up. The answer for this question is D. The familial form of this condition is associated with nephroblastoma. So the condition is aniridia and foveal hypoplasia. Inheritance is autosomal dominant, and usually the vision is poor. But usually the sporadic form of this condition is associated with nephroblastoma. So
And
that
sorry, Varsha, if I may interrupt, I just wanted to give a take-home message for the neophytes, at least, who are attending. We have a mixed bunch of participants. The mnemonic is WAGR. When you see an aniridic patient, at least anyone, any ophthalmologist, you don't need to be a glaucoma person. Make sure you run the Wilms tumor, aniridia, genitourinary abnormalities, and the mental retardation part of it. And make sure you advise an ultrasound for that patient, because that is very important. The moment when we see aniridic patient, a family history, and ultrasound examination. So that is one take-home message that I just wanted to share to the neophytes who didn't know about this. Advise an ultrasound abdomen.
Definitely. Yes, sir. All right. So the next question, question number 13. The following measures can be taken to limit post-operative hypotony with the device in the figure, except A. Two-stage procedure. B. Collagen flux. C. Pressure-sensitive valve. And D. Ligature occlusion of the tube. And your time starts now. So all right, the last 1 second, and it's done. All right. The answer to this question is the C, pressure sensitive valve. The implant shown in this figure is bare wrist implant. Hypotony is post-operative hypotony is usually avoided by making it as a two-stage procedure, and it can also be avoided by using occlusion of tube lumen with the ligature, or using collagen flux. So the answer is pressure sensitive valve. It's that's the answer. Next question, question number 14. Tursin syndrome may have A. Retinal hemorrhages in patients with spontaneous or traumatic subarachnoid hemorrhages. B. VH in patients with spontaneous or traumatic subarachnoid hemorrhages. C. Both A and B. D. Neither A nor B. And your time starts now.
You know, when always there's a question like it, it's either, you know, both or neither.
Yeah.
No. I think you are given the 50-50 option in Crorepati. For me, I was pondering over whether A or B. I belong to the minority or the majority category, like I would like to call myself. So I think you gave a 50-50 clue. Or you may be confusing the participants. I don't know.
That can also happen, right?
Confuse them. I hope I confuse them. All right. Going to the answer. All right. It's associated with both. It can be associated with both retinal hemorrhages and vitreous hemorrhage. So it's C, both A and B. All right. Question number 15. An abnormality in which eyelid structure can cause this clinical presentation? A. Palpable conjunctiva. B. Tarsal plate. C. Orbicularis oculi. And D. Periocular skin. And your time starts now.
I think this is a very important basic science question for aspirants of FICO or FRCO basic science. I think this is a very important question.
Yes, sir. All right. The answer for this question is D. Periocular skin. The patient shown in this figure has epiblepharon, an anatomic variation where a redundant fold of periocular skin causes the inward rotation of eyelashes, causing trichiasis. All right. So the next question. A newborn infant presents with this finding. What developmental anomaly caused this presentation? The options are A. Incomplete precursor of embryonic fissure. B. Faulty migration of neural crest cells. C. Exuberant proliferation of glial tissue. And D. Abnormal retinal differentiation. Your time starts now.
So actually, each option is pathology for one disease. So
Yes, sir.
if you just take a close look at the picture, you're going to find the answer.
Definitely. Last 5 seconds. All right. So the answer for this question is A. Incomplete closure of the embryonic fissure. So the patient shown has a large chorioretinal coloboma. So this will be the pathology of this condition. Moving on to the next question. A 2-month-old boy with a large angle esotropia and apparent cross fixation presents to your office. So the least likely diagnosis on your differential is A. Congenital esotropia, B. Mobius syndrome, C. Dense amblyopia, and D. Congenital fibrosis syndrome. And your time starts now. Now carefully go through all the options. It may be confusing a little bit.
But the cross fixation is the key here. Yeah.
Yeah. All right. Okay. Going on to the answer. So the answer is dense amblyopia. So congenital esotropia, Mobius syndrome, and congenital fibrosis can all present with this. But because the patient has cross fixation, dense amblyopia is very unlikely. So that will be the answer. All right. So next question. A 12-year-old boy involved in a motor vehicle accident 3 months ago presents with a complaint of left-sided epiphora since the accident, along with a 1-week history of fever and progressive swelling, redness, and pain in the left medial canthal region, with mucopurulent discharge from the medial canthus. The appropriate initial workup of this patient includes all of the following, except a complete ophthalmic examination, CT scan of the orbits and sinuses, probing and irrigation of the left nasolacrimal system, and culture and gram stain of the medial canthal discharge. The time starts now.
I think this is again a very, very common incident that I have seen in my postgraduate days, where we had our hospital situated on the ECR road in Pondicherry, East Coast Road that we call down south here in Tamil Nadu, Pondicherry, where many issues of similar things like these
Yes.
usually present there after a motor vehicle accident.
Yes. All right, your time is up. The answer for this question is C, probing and irrigation of the left nasolacrimal system. This is acute dactyl cystitis, so probing is definitely not indicated. Complete ophthalmic evaluation is definitely necessary because if you look at the image closely, the patient has left-sided esopropia, so we have to do an ophthalmic examination. Culture and gram stain may help in antibiotic therapy, and in situation of previous trauma, radiographic examination will help evaluate any anatomic changes. All right. So the next question: the reliability of visual field testing becomes suspect when pupil diameter decreases below A 4 mm, B 3 mm, C 2 mm, and D 1 mm.
This is again,
Start.
yeah, we can start the timer.
Yes.
This is again a very practical and very important question because when at least for exam going PGs or neophytes who are here, the pupil size examination in the visual field chart is very important, especially when there was pilocarpine before when we were using it. Now it's not being used as an AGM anymore.
Yes.
That time the pupil size really mattered because the constriction of the pupil was causing so many artifacts.
Yes.
So that is where pilocarpine was not actually preferred. Or if you can still see in textbooks, there are the pupil size. Did you note it while examining a visual field? It's a very important exam question as well as for real-time practice.
Yes. Okay. So the answer for this question is B 3 mm. So a pupil diameter of less than 3 mm can cause generalized depression of the field. So it's always better to have a pupil larger than 3 mm as well. So like sir said, if patients have been taking pilocarpine, which we don't see anymore, they have to refrain from taking the medication for at least 24 hours before the test is being done. So going on to the next question. Applanation tonometry.
So sorry to interrupt you, Varsha. Once the question is over, we'll have the leaderboard. Yeah.
Yes, sir. Yes.
Go for the next one.
Yes. Applanation tonometry gives falsely low readings under all of the following conditions, except A, high myopia, B, decreased central corneal thickness, C, excessive fluorescence, and D, greater than 3 diopters of visceral astigmatism. Definitely think over. There might be a slight trick to the question.
Yeah.
And your time starts now. Sorry. All right. The time is up. Okay, so the answer is C, excessive fluorescence. The trick was that the people might get confused with the last option as well. So if corneal astigmatism is greater than 3 diopters, IOP is underestimated for visceral astigmatism, whereas it is overestimated for only against astigmatism. So that is a point that people have to consider. So this was the trick part of the question. All right. So
and again, from a practical point of view, everybody, when we start our journey, we always have the tendency to actually overstain or understain when we do an applanation tonometer. So this is again very important because at least in the initial days, we need to know whether we are overestimating or underestimating the IOP, and it goes with the staining that we do. So that is very important take-home message. And I think we have come to the end of 20 questions.
Yes.
And I would like to actually congratulate you once again, Varsha. This is your first quiz as a quiz master. You've done a good job. Yeah, it's mutual. It's a pleasure is ours. Where you have really put in all practical take-home, important basic sciences or be the clinical part. I think Sai sir, are you ready with the leaderboard for the end of 20 questions?
Yeah, now in third place, we have Dr. Alice Thomas again. Okay, Alice Thomas, I think you can just say where you are from. We just missed it last time when you just waved us a hi. Can you once again reintroduce yourself? Yes.
Sir, my name is Alice Thomas. I'm from Kerala. I'm presently working in Little Flower Eye Hospital.
Great. Excellent, doctor. Yeah.
We have Dr. Miro Augustine on the second place.
Yes, doctor.
Hello, sir. I'm Dr. Mayur Agustin. I'm from Kerala as well. I recently completed my DMB ophthalmology from Chaitanya Trivandrum.
I hope your connectivity is good. I'm seeing that you are traveling. Still, there are 20 more questions to go. Yeah,
Yes, sir.
I wish your connectivity good luck. Yeah.
Thank you.
And now Dr. Kaushik Tripathi is on the top.
Yes, we were Niranjan was waiting for him for a long time, I suppose. Dr. Kaushik, can I say hi to you? Yeah, hi, Kaushik. So nice to. I'm not able to see you, but you're there.
Yes, I'm there. Camera is not working.
Yeah. You can introduce Kaushik for the benefit of the other people from where you are from.
I am from Kolkata. I am a retina consultant at ASTI Hospital, Kolkata.
Yes. Thank you, Dr. Kaushik. Wish you all the best for the remaining 20 more questions. Rock as usual. Right. So now we had a clinical a basic sciences from Dr. Varsha from Mahathma Hospital, a glaucoma fellow and a very vibrant young person. And she really brought out a lot of common scenarios that we tend to face in our practice or very basic science point of view. So now we have our star quizzer, who is one of, as Varsha showed, he has almost won all the quizzes that happens in India or outside India. He's one of the prides of our India, actually, we should say, along with many other few who are also participants here. Like we saw Kaushik now just speaking with us. So it's a really wonderful celebrative event that I should say. It's not a very rough or a very rigid one. We are just having a celebration of 25 years of Mahathma Hospital. So I hand over to the young and vibrant speaker and the quizzer, Dr. Niranjan Karthik, to finish off the innings. So I think we are going on time at 6:42, and I think you will finish it like Dhoni for the cricket fans who are also participants today. So I'm handing over to you to make sure you finish it like Dhoni for the toss for India-Pakistan match. Yes, Niranjan.
Thank you, sir. That was very, very magnanimous of you to give me such a sweet introduction. Thank you so much. So I guess we are set for the second innings, like what sir has mentioned. So I'll just quickly share my screen. Is my screen visible?
Yeah, it's visible.
So we're going to have a different round of questions this time. So first 10 questions are going to be of one kind, and then we're going to move on to a second set of questions. So let's start. Okay. So let me take the hot seat right now. And yeah, question number 21. Which of the following conditions is not known to have conjunctival telangiectasia? Option A, Lewy bar. Option B, sickle cell disease. Option C, Bournville disease. Option D, Fabry's disease. Your time starts now. So one another component of quiz is that, you know, usually we tend to come across multiple names of the same disease, and it becomes important for us to know it is what it is. So that is another area which I wanted to focus on rather than giving the usual names. These are other names of common diseases. So time's up. Let's move on to the answer. So it's actually Bournville disease. Bournville disease is nothing but tuberous sclerosis, whereas Lewy bar syndrome is the other name of ataxia telangiectasia. And these are some other conditions which are associated with conjunctival telangiectasia, right? So we have about 30% of them getting it right. So let's move on to the next question. Meckel's classification is used for which of the following conditions? A, choroidal melanoma. B, trachoma. C, globe rupture. D, chemical injury. Your time starts now.
I think
see the name carefully.
Yeah.
There are quite a few of them which sound similar. So just before you lock in on the answer, read the name once or twice again. That's another tip I would like to give.
Mostly when we study, we just like mug up fast and we go off, you know, we just see the MC and we are like, okay, done. So let's see how much you got it right. Oh, okay.
About 1/3 of them have gotten it right. So the answer is chemical injury. So we have similar naming classifications like calendar, Meckel's classification and things, which are used for other options that we've discussed. So here it's used for chemical injury and it has 4 different phases, right? So let's move on to the next question. See the imaging that is, see the image that is shown here. Identify the most probable complaint or history in this patient. A, history of ocular surgery in the past. B, history of multiple sittings of laser in the past. C, chronic history of wearing thick glasses. And D, long uncontrolled diabetic history.
In the future, everyone is going to be performing cataract surgeries. So I think it's a must to be thorough with the scan.
There can be a little bit of confusing options, but I want you to choose the most appropriate. That is another thing. I've made it slightly tricky because I wanted it to be that way. So please choose your options wisely. Okay, about half of them have gotten it right. And the answer is A. Here, it is the A scan of aphakia where the lens spike is actually missing, which can be compared to the normal A scan picture that is shown on the right in green. So answer is aphakia and option is A, right? Right. Identify the pattern with congenital stationary night blindness among the following patterns of ERG. Have a close look. Your time starts now.
Fortunately, these were not kept for us in our exams. I think nowadays it's an important part of Viva, right, Niranjan?
Yes, actually, ERG is one of the charts that are kept for exams. So it's quite important that we are a little bit familiar with the common conditions which are diagnosed. Okay. So we have the answer. It is actually A, where what is most important. Now, this is a chart that compares different diseases which can be diagnosed with ERG. So here, what is most important is to note that the scotopic response is grossly damaged in CSNB. So that is a very important hunch among the 4 options that were given. And one of them was a normal ERG actually. So answer is option A, right? So let's move on to the next question. Name the clinical condition that is related to the jumbled words below. A, ARMD, B, diabetic retinopathy, C, cystoid macular edema, and D, CRB. Okay, time starts now. So have a close look at the jumbled words and see what they are, decipher them, and then choose your option.
Too many studies nowadays. Clinical trials are itself a separate book to study. So I think people will get this one right. Yeah, very common condition. Yeah.
Right.
Somehow I disagree with you, Dr. Shruti.
See, I think.
Okay. Right. That's nice.
You see this knack of telling difficult questions, people will all get it right.
Option is CRBO. It is the SCORE study and Copernicus study where they spoke about intravitreal injection of triamcinolone and aflibercept, respectively. Right. So moving on to the next question. So here's the personality. Here's the clue. Identify. Jerem, Vogt, Becker, Seidel. Your time starts now.
Even if you don't know the name and the flag symbol, the third image will give you the clue.
So there's a lot of things that's named after this person, but I've kept something which is not that commonly what we come across. We have quite a few other things which are quite common named after him. Okay, 80%. That's nice. So 80% have gotten it right. I am quite happy about it. Good. So it is Alfred Vogt, Swiss ophthalmologist, and it was Vogt's limbal girdle in the third picture. Okay, right. Moving on to the next question. Let's slightly go out of core of that. And here we have a movie, and the movie's title is All I See Is You. And I want you to tell me which is the condition that was emphasized on in this movie. A, glaucoma, B, cornea, C, uvea, and D, retinitis pigmentosa. I mean congenital, glaucoma, blunt trauma, sympathetic ophthalmia, or RP. Your time starts now.
I hope we have a lot of Blake Lively fans over here. Should be.
So we have another 5 seconds to go. Right. So let's see the answers. Okay, we have quite a distributed pattern in the answers. So it's actually blunt trauma, where the corneal transplant was the major turning point of events in the movie. So if you get time, do have a look at the movie as well, right? Okay. Question number 28. Identify the pathology associated with the painting by a world famous painter. And it actually retrospectively sort of helped in diagnosing what he had. A, glaucoma, B, red leaf blindness, C, cataract, D, stroke involving the occipital lobe. The time starts now.
So this is when he painted through two different eyes. One is to the left eye, another one is the right eye, like that, or is it binocular?
Actually, sir, it is pre and post cat. Post the.
Rosanna gave the answer.
Sir is playing for the participants, I think. Sir, is there a. Okay. Still, the answer is divided.
Yeah.
Sir, the answer.
Tricking the quizmaster.
Yeah. Sorry about that for all the people who really knew the answer. But anyways, we have sort of a split, opinions. It's actually cataract, and the painter was Claude Monet. So it was pre and post cataract surgery that there was a difference in the sort of colors that he perceived because of the color differences he had before and after cataract, and the light being dispersed into different colors. So we'll move on to the next question. Right. Question number 29. Identify the structure X. Glands of Zeiss, glands of mole, glands of Cross, or glands of Wolfram. Your time starts now. Well, yes, it is a gland. So find out which one of them it is. Sir, your thoughts on the difficulty level of the question? Quite easy, right? I mean,
Difficulty level 100 max.
Try to keep
No,
it funny.
I'm just kidding. You are going well. I'm just trying to break the ice. It's a fun quiz. It's a fun and celebrated quiz. So I think the participants are also enjoying it, is what I believe. And as you rightly said, this is again a very important basic science question where you need to know. Only when you know this, when you have a pathology like aureolum externum or aureolum internum or a chalazion, so we really need to know which anatomical structure is involved. So this is very important from anatomical point of view.
Again, the answer sort of distributed over all the four options, but the most common one is the right one. Yes, it is glands of mole. And
one suggestion you can go back. One suggestion that I would like to give for the participants is the hair follicle, the glands that are associated with the hair follicle. So you can see the glands of Zeiss are actually adjacent to the hair follicle, whereas the glands of mole are not. So that is very important, because when there is a aureolum externum, you just pull off the hair follicle, right? The whole pus comes out. The same thing does not apply for mole. So these are some practical things that is very, very important that we see in our general OPD. So any specialty, this is very important. Yeah.
And Cross and Wolfram are usually the fornicial ones. So you
Correct.
identify them there, whereas these are towards the lid margin, right? So we move on to the question number 30.
Yeah. After that, we'll have the leaderboard.
Yes, sir. See the question carefully, see the images. Urine test will not be useful in which of the following conditions? A, B, C. Your time starts now. Understand what the conditions are and then go for your option.
So again, very, very, very well compiled images that I should say by Dr. Niranjan, because now it's testing your imaging, the diagnostic ability by seeing the images. Then so once you know the images, you need to know whether the urine test is needed for that patient or not. So again, these are all triggering the different aspects of your brain, the quizzing part of your brain. So yeah.
So we have a good response of right answer. So it is C, and I'll answer is C. Option A was gyrate atrophy, where ornithine levels are elevated. Alkaptonuria in B, where homogenesic acid is elevated in the urine. And option D was PDR, proliferative diabetic retinopathy, where glycosuria is common. Right. So with this, we come to the end of 30 questions. And Sai sir for the leaderboard. Okay. So I think we have a little bit of change in the leaderboard here. So we have at position 3, Dr. Mary Stephen. Can we have you on screen, please, Dr. Mary? Okay. Hi, sir. Hi.
Mary Stephen is here. No.
Hi, sir.
Yeah, Dr. Mary Stephen, you can tell where you are from. You're almost there. 75% of the race, you are on the third place. You can tell you where you are from. We'd like to know about you.
Hi, sir. I'm from Pondicherry. I'm working as senior resident in Jipmer.
Oh, very nice, very nice. Okay, very nice, very nice. Hope to see you at the end of the race. Congrats on all the best for them.
Next, we have Dr. Jayashree P.
Do we have Dr. Jayashree?
Hi, hello, sir.
Yes, doctor. I think you are in two devices. Anyway, you can tell where you are from. If possible, you can show your video.
Yes, sir. I'm working in JIPMA as senior resident.
So you and Mary Stephen are sitting together and answering?
No, sir.
Just kidding, just kidding. Yeah. Yes, the first
And
one.
on top of the table, we have Dr. Kaushik assisting at position number 1. So
Yeah, Kaushik, once again, best wishes to you. You're there. You want to show your face now to us?
Camera is not working actually.
Yes, only at the end after winning. Okay, fine. All the best, doctors, all the three. Yeah.
right. So
Sorry to interrupt.
Yes.
There was a option change in question number 29. I put the right answer. So there were queries in the chat box.
Okay.
I just want to let you know that it has been corrected. So the computation has been redone again.
Yes, perfect, sir. Thank you, Sai sir, for always having our back. Whenever any technical glitch or something happens, we try our level best to avoid it. But if something happens, Sai sir is the best person to go. And thank you once again for being there for us. Thank you, sir. Yeah, over to you, Niranjan. We had a nice 75% or 3/4 of the race. I think the last lap where every one of us will now try to push towards the victory line. And not 3, we have 25 winners. So we are going by time, and the last segment is all yours. Make sure it's as rocking as it was. Yeah.
right. So we come to the last part. So the next 10 questions are going to be of one type. It is going to be about matching between options. Okay. So I want you to carefully have a look at the question, the options, and then go for the option. So this is a disclaimer I would like to give up front. So this is to give a feel of a rapid fire sort of a feeling at the end, right? You're going to have the same 20 questions. Same 20 seconds for each question. So I would suggest that you buck up, be alert, and let's go. Question number 31. Find the right match between the options A, B, C, and 1, 2, 3. Your time starts now.
This was not in the syllabus at all. Suddenly the quizmaster throws a googly.
So the plan is to sort of dissipate as much of information as possible with each question, because with just 20 to 40 questions, it's I just wanted to give it maximum, sir. So that is the idea behind this type. So
and one more thing for the participants is, sometimes if you're lucky, if you know one particular match the following, you may end up actually diagnosing the whole sequence also, if you are lucky in that aspect.
So we have 63% of them getting it right. And I think they're going to use the card that Prasanna sir has just placed in front of the participants. So yes, answer is option C. So I'll just explain quickly. A is Stickler syndrome, and you're seeing a flat nose, and along with that vitreous degeneration. B is Sturge-Weber, where there's portoine stain and choroidal hemangioma. C is tuberous sclerosis associated with retinal astrocytoma. So this is the connect. Okay. Question number 32. Match it right. Your time starts now.
Everything looks pink and purple. Yeah.
I really wish I knew
just like the Niranjan's movie. He had a movie poster, no? It looks like that for me. Can mix it.
Okay.
But I'm sure Niranjan will have his answers as to how to read all the 3, A, B, and C. So that only is going to be
50% of them getting it right. So answer is option B. So here what we want to focus on is try to have a clinico-pathological correlation for our practice. So option A has AML, which is focusing on the OR rods, and one is masquerade syndrome with pseudohypopion. B is CLL with smudge cells, and option 3 is leopard skin appearance in lymphoid leukemia. C is sickle cell anemia, where there is sickle cells, and that's to correlate with C5 neovascularization, right? Moving on to the next question. Your time starts now. So in a way, it is easy if you can get 1 or 2 right, but only the trick comes in when, there's only one option with 2 similar answers. So only 1 point will be differentiating. So kindly choose your answer right. You don't want to be sort of confused about the options. Okay, I think we have 48% of them going with A. Let's see the answer. Yes, it is A. So for those who wanted to know, A is actually among this 6 images. A is actually sunset glow fundus associated with VKH, where you see PAS, peripheral anterior synechiae, which is seen in image 2. B is choroidal rupture in trauma, correlating with angle recession image 3. And C is CRVO with neovascularization of angle in image 1. So that brings about the answers. Moving on to the next question. Time starts now.
I think so much of knowledge to be learned from a single slide. Where,
yes, that was the whole fun of this type of questions.
Because even now OSCEs are conducted this way, it's images and questions. So it will be very helpful.
Okay, so right, we again have option B in the leading with about 50% of them getting it right. So it is B. The reason is A is retinoblastoma, which is correlated with the enucleation spoon in image 2. Whereas B is choroidal melanoma, where you use plaque brachytherapy with radioactive seeds, and C is rhabdomyosarcoma, where you use a periosteal elevator for accentration, right? So this is the explanation. Moving on to the next question. Your time starts now.
even for aspirants who are going to take ICU exams in the basic sciences, these are questions which are actually practically being asked. So Niranjan is taking you through a good module of basic science and pathology.
Right. So answers are here. Option C is the most common. Yes, that's right. So A is actually squamous papilloma with its image in 3, where you're seeing the papillary fronds in histopath. And B is choroidal melanoma, where you're seeing melanin-containing cells in image 1. And C is Langerhans cell histiocytosis, where you're seeing tennis-shaped cells in image 2. Right. Moving on to the next question. Time starts now.
So in this picture, something that is very important for us to take home is always when we do an eye examination, some pathologies want us to actually go beyond. We need to go beyond, examine the teeth, maybe examine the umbilicus, maybe for some retinal pathologies, examine the fingers. There are so many things that is, eye is just a window where we have to go forward and do the other examination for ruling out systemic abnormalities.
So here we have the answer divided between B and D. Let's have a look at the answer. So it is D, and I'll explain why. So A is actually filamentary keratitis associated with Sjogren syndrome, where you see dental caries, as you see in image 3. B is interstitial keratitis, which is seen with Hutchinson's incisors, which is seen in figure 1. And C is Axenfeld-Rieger syndrome with polychoria and iris stretch holes. That is associated with micro and hypodontia, as seen in image 2. So that's the answer and explanation. Right. Your time starts now. So have a careful look at the images and their corresponding findings below.
And even the exclamatory mark is actually a finding for people who think the image was actually not there. That is the clue. So, yeah.
Right. So again, we have a divided answer. I think that one option going this way, that way is the key here. Right. So I think the game's working. Right. Okay. So question number 37, the explanation goes with answer B. So I'll explain why. So A is actually congenital dystichiasis, the second row of lashes, which is associated with lymphedema. That is the option A. B is matarosis or loss of eyelashes, which is associated with alopecia areata, which is associated with exclamation mark hair seen in alopecia areata. And option C is poliosis, which is associated with Vogt-Koinage-Harada syndrome, again seen in image 2. So these are the explanations for this question. Okay, moving on to question number 38. I think this pretty much is a sitter. I hope everybody gets it right. Your time starts now.
Somehow, with your sitters and Vaishali's easier questions, somehow I don't agree with you. I choose to differ. Yeah.
No, because koyotama, hamatama, these are the trick words that people use, in this is also. So yeah.
Let's see. Wow. Okay. Again, the answers are equally distributed between A, B, and C. So A is dermoid, right? So before that, I'll have a look at the answer because it's quite confusing for myself as well. So answer is B, right? So A is choristoma. It's a dermoid, right? B is a malignancy, which is choroidal melanoma. Conjunctival melanoma. And lastly, C is actually hemangioma, which is a hama. So this is the connection between the terminologies and the images that we need to make, right? Moving on to the penultimate question of our quiz today. Here you go. Time starts now.
So again, gene therapy, that is very important once again, where how do you match the clinical diagnosis with the gene therapy? And this is also something which is very important, is what we would like to emphasize once again for all the participants.
Okay. So we have a divided opinion between B and D. Let's have a look at the options. Answer is D. I'll explain why. So A is aniridia. Okay. Aniridia is associated with PAX6 mutation. B is blepharophimosis syndrome, which is associated with FOXL2 gene. And C is actually primary open angle glaucoma associated with TIGR. So that's the explanation. So last question of the day. Match the right options. Your time starts now. Five, 4, 3, 2, 1. I think.
And then you go for the toss. You're looking up. I thought the toss is going to come, because the way you are going, it looks like you'll finish it before the toss.
I think again we have a divided opinion between A and C. Let's see the option. Answer is A. So A is actually third nerve palsy, where you can see that there is multiple extraocular movement deficiency. B is associated with Brown syndrome, where there is a entrapment of the superior oblique, and C is actually sixth nerve palsy, where there is abduction deficit. So I think with that we come to the end of the quiz today. So we'll request Sai sir for the leaderboard. Meanwhile, Prasanna sir, you can please take.
Yes. So I think I should really credit both you and Dr. Varsha, especially for such a wonderful conclusion of the quiz. I think you promised the participants you will finish it before the match, but you finished it before the toss. So I think true cricket lovers who are attending the quiz, I think they'll value that, and even others who feel to keep up time in their practice. It's a 6 to 7:30 event, and it was a good flow also. And I personally learned a lot of new things, even in today's event, where some of the information, it was very new to me also, where beyond glaucoma, I tend to forget things nowadays, but these kind of academic activities helps me brush up things out. And it was a very good module where Varsha took over the basic science with a lot of clinical related aspects. Then Niranjan took it into a whole different level. So we really wanted people who are really passionate about it. And since it's a celebratory event of 25 years, we felt Niranjan will be the right person to lead the pack for asking the questions. And we are happy that we have a lot of people participating all over our country. That is really, it's very heartwarming to say the least. Many of my friends, Dr. Kaushik, even Dr. Prasav Mohan sir, along with Niranjan, they are all being very prolific quizzers. It really matters a lot that we had you on board. Along with all the 88 participants is what the maximum count was at a particular point in time. I think Sai sir can correct me if I am not wrong about the number. So the event for today is, it's about eye donation. So till Sai sir is compiling the results, I just wanted my fellow participants to just take them over to one particular video of eye donation that we made to actually create awareness, because it's all for a noble cause, is at the end of the day what we all are talking about. So my dear friends, once again I reintroduce myself. I'm Dr. Prasanna Venkatesh Ramesh. I'm also a YouTuber come ophthalmic content creator. I have a channel called Prasanna Venkatesh Ramesh. It goes under the same name, and I have around 1,000 subscribers. Feel free to visit my channel. This is one particular eye donation awareness video that it's only a minute and a half, where we just made it through candles and color balls. So I think I'll just play it, and then before that, Sai sir can get things ready. Sai sir, will the audio come, or should I share it anything specific? This particular video.
I think the audio is not coming out.
Uh,
Stop sharing and play it again.
When you give share screen, you select the advanced option and share audio also.
Share audio, yeah.
Okay.
Yeah.
I'll
The
just-
share screen option itself, it will come.
Yeah, yeah. Advanced
There is
and
share audio separately.
computer audio.
Yeah.
Yeah, got it. For sharing, you can see my screen now? No,
Not yet.
not. Just a moment. Advanced and no?
Yeah, now
Just a
it's
portion.
just a portion of it. Yeah. Maybe you can just play the video.
Yeah, yeah, I can also take them through it. Now the audio is coming?
Yeah.
Audio is fine?
Yeah, we heard the audio, but now it's paused, right?
Yeah, I just paused it. Yeah, just the video that we have done from Wealth from Waste is what we like to share in this eye donation fortnight till the results are getting ready.
Any,
So thank you, everyone. for your time, and we really wanted to do something novel as well. So that's why we made a video for eye donation, and this is my channel. So this is my channel, which goes under the name Prasanna Venkatesh Ramesh. Not only this, we have a lot of academic videos as well. So myself being a glaucomatologist, I'm also a ophthalmic content creator. So whenever you're free, please do visit the channel, and we have made a lot of useful animative videos and other things that may actually help you in the long run, along with the eye donation video that you just saw. So yeah, right, we have the results up and running. So Dr. Niranjan, I think over to you for the honors to read out the person who came 25th. So as promised, we'll finish it on 7:30. We have 14 more minutes, and I think we'll take it as and when it is. So 25th, you can call out Dr. Niranjan. Take the honors of calling out the person who came 25.
Yes, sir. I request all the participants to be quite ready as we call out the names so that we can make it quick.
And you can all show your face. It's very casual. It's a celebration of 25 years. So I think we all would love to meet you, because we also wanted to break the ice. And most of you are our colleagues and friends, and we all almost know each other. And it'll be really nice to have a good Sunday evening with you for the next 10 minutes or so. So, yeah.
So at 25th position, we have Dr. Anis Tefi. So can you please switch on your video and say hi and where you're from? Could you please unmute yourself?
Sir, good evening, sir.
Yes,
My
doctor.
name is I'm from Kanyakumari district. I am currently doing my glaucoma fellowship in Bajan Singh Eye Hospital.
Okay, excellent, doctor. So this is again a good occasion to know each other. So we have a participant from Kanyakumari, and she's a glaucoma fellow, and really well done for entering into the top 25, Dr. Annie Steffi, if I'm pronouncing you wrong. And thank you for participating, and congratulations on winning the 25th position. For all the 4th to 25th participants, you have a 500 rupee cash prize award, which will be given to you after the event. Niranjan and myself will be coordinating on it. And now over to Dr. Shruti to read out the person who came 24th.
So on 24th, we have Dr. Geeta Ravidas. Can we have Dr. Geeta?
Yes, ma'am. Hello.
Can we see you, doctor?
Sir, I am from your institute only. I'm doing IOL fellow in
Great.
Mahathma Hospital.
But we would like to see you for the benefit of the other participants who may not have seen you before. Is there a possibility?
Sir, I was actually out, so I don't want to.
Great. So Geeta is our own medical officer from Mahathma Hospital. And I hope Niranjan or Varsha did not leak you. I know you, just for you.
No.
Yeah, just for fun, I'm asking. Just kidding. Yeah, good. Great. Congrats, Dr. Geeta. On 23rd, Varsha, please do the honors of reading who came 23rd.
On the 23rd place, it's Hemant R. Hemant R. Please unmute yourself and please introduce yourself.
Good evening, sir.
Yes, doctor.
Like I'm actually a junior resident in Jitmar, sir.
Yes, doctor. Very nice to have your participation. And before Niranjan calls out number 22, I think you can also just show your video for that particular moment, and we can all see you, because still we are around 52 in number. Your peers can see who you are, and we can get to know each other. So 22nd, over to Niranjan to call out the 22nd winner.
22nd, we have Dr. Pankaj Kumar.
Dr. Pankaj, can we see you?
Hi, sir.
Yes, doctor. Can we see you? Yeah, you are there.
Hi.
Yes. Congrats.
Dr. Pankaj, I'm doing my final year PG at Joseph I Hospital, Trichy.
It's very nice. Congrats on your coming rank 22nd, and really nice to have you here on a Sunday evening. So over to Dr. Shruti to read out 21st, who came 21.
We have Dr. Atira Devaraj. Congratulations, doctor. Can we see you? Dr. Atira.
Please unmute yourself. Dr. Atira, please unmute yourself.
Okay.
Hello, ma'am. I'm Atira. I'm a pediatric fellow in Aravind Eye Hospital, Madurai.
Okay. Hi,
Okay.
congratulations.
Very nice, doctor. Really well done. For 20, can we have Dr. Varsha to do the honors?
In number 20, Dr. Sheetal. Dr. Sheetal.
Evening, sir. I'm Dr. Sheetal, doing my glaucoma fellowship from Aravind Hospital. I'm from Chennai.
Aravind Eye Hospital, Chennai. Great. Very nice, doctor. All the best for your future ventures also.
Thank you, sir.
We have on 19th, Niranjan, please do the honors for 19.
At 19, we have Dr. Shahija Aisha. Can we have you on screen, ma'am, please?
Hello, sir. I'm Shahija Aisha. I'm from Kerala, third year GR.
Kerala, where are you, doctor? Which institute are you practicing?
Code Medical College.
Code. Very nice. Yes. 18th, over to Dr. Shruti.
Then we have Dr. Gomati Nayagam. Congratulations. And I think we saw you last time also in the awardee list, if I'm not wrong.
He was there in Capsule 1 also.
Yeah. Congratulations, Dr. Gomati.
Is there? Yes, sir.
Yeah, good evening.
Hello, sir. You can introduce yourself for the benefit of the co-participants and the others of New Mahathma.
Yeah, good evening. I did my post-graduation at RIO 3 years back. Now I have completed my bond in government and then I have joined Aravind Eye Hospital, Tirunelveli.
Okay, very nice, doctor. Then we have on 17, Varsha, please do the honors for number 17.
Dr. Kripa.
Hi, sir. I'm from Madurai Medical College doing final year post-graduation.
Okay. Thank you. For 16, let me do the honors. My good friend, we are almost 1 or 2 years, almost in every meeting, we are all meeting up in AOS and YOC, wherever we share a lot of podiums together. And she's a very dynamic and active person in YOC as well, along with Kaushik Tripathi, who is also leading the leaderboard. So we have Aarti Hida. She's not many will be knowing. She's very active in the YOC forum and very dynamic person when it comes to conducting a lot of events. And really, Dr. Aarti, it means a lot that you attended our event. And over to you. Please introduce yourself for the benefit of the other fraternity. All are yours, actually. That is one major thing that we just saw now. And Aarti is conducting Surfing the Anterior segment in YOC. So she's taking care of that. And over to you, Aarti. Please introduce yourself for the benefit of others.
Thank you so much, Prasanna. The introduction is already over when you called me your friend. So that's it. That's enough. Yeah. Then other thing is I'm basically based in Pune, an anterior segment surgeon. Let me congratulate Prasanna, you and your team for wonderful quiz. And believe me, the questions were not easy. In first 2 rounds, I was, I think, at the 5th position and then 7th. And then I got 16. Thank God you have 25 prizes. Otherwise, I would have been out.
No, Aarti, that is what I was also telling Varsha, Niranjan and Shruti Vaishali. They were all telling it is easy. I told them I am not able to answer. I don't know most of the questions.
It wasn't easy. And then especially when you have too much of retina, Dr. Kaushik has to win the quiz.
Yeah, next time we'll have him on board.
Yes, he should be conducting your quizzes.
Yeah. Next time we'll plan.
Anyways, thank you so much. And more than winning, it was the participation which was more important. And I hope I continue doing the same.
Very nice, Aarti. Thank you.
Congratulations once again.
It really matters a lot. Most of you, they are getting introduced to you. They would have seen you on a lot of flyers. So it really matters for the other Yos as well. So that once again, a big round for actually coming to participate today and being with us today to share the screen with us. Thank you, Dr. Aarti.
Kaushik sir, looks like we are the only person from not from South zone of India, I guess. Yeah, nobody else is there. Everybody is from South.
More than anything, Kaushik and Aarti. Kaushik is also as good friend as mine as Dr. Aarti. I think we'll come to Kaushik when we come slightly higher, I suppose. But really, thanks for being here and making the pan-Indian quiz. And Mahatma is very honored and humbled to have you along with all the other participants for expanding the reach for the 25th year celebration. Thank you. Thank you once again, Aarti.
Thank you. Thank you
Also,
so much.
Dr. Aarti is taking crucial like a part in medical legal, the medical legal core team of EOC, on
Yes.
which we are arranging every monthly programs for all ophthalmologists all over India.
Yeah, at the end, I think Kaushik, you please take when it's your turn, do share about the activities of what we are conducting so that it benefits even wider for the POCs when you have the stage, if I'm not wrong, when you come on the top. Yeah, we'll move to the next. As we promised, for want of time, we'll finish it before the India-Pakistan match. Many people today messaged me that please finish it at 7:30. We want to watch from the first ball. So that's the only reason we are pushing ahead. 15th over to Niranjan for calling out the 15th.
At 15th position, we have Dr. Raghuman. Can we have him?
Yes,
Yes,
doctor.
sir.
Sorry for making you wait, doctor.
How are you,
Please
sir?
introduce. Yeah,
No
all
problem, sir.
fine. Yeah, all fine. We all are meeting again in a different box. Yeah.
Yes, sir. So from
Yes, doctor.
SRM Trichy, sir, senior resident.
Yes. Please introduce yourself for the others also, so that they'll also know you. Yeah.
I'm from SRM Trichy, sir, senior resident. Completed my postgraduate in Tanjore Medical College, sir.
Yes, very nice, doctor. All the best for your future ventures as well. Over to 14 for Shruti.
Thank you,
Please do
sir.
the honors.
So we have Dr. Sendamil and Rene. Congratulations. Can we see you? Doctor.
Yes, sir.
Yeah. Hello, I'm Dr.
Yes, sir. Yes, sir. Good evening, sir. Yes, sir.
Yeah.
Please introduce yourself, sir, for the benefit of others, so that a lot of participants would also want to know about your work.
Yeah, I work in Government General Hospital, Pondicherry.
Yes, sir.
Practice where I met.
It really matters a lot, sir. Thank you for taking your time on a Sunday evening to be part of this event. As a very senior ophthalmologist, it really matters a lot for you to join in our 25th year celebration. It really means a lot. Thank you, sir. Our sincere thanks from the bottom of our heart. Thank you, sir. So we'll move to rank 13. Dr. Varsha, can you please do the honors?
Rank 13, Meru Augustine. Dr. Meru Augustine. Congratulations, doctor.
Doctor, can we have you on the screen? Dr. Meru Augustine. Okay, I think we don't have her currently with us. If Dr. Meru Augustine, if you log in, please do let us know at the end. So we'll move to Varsha. You can call the next person, rank 12.
Dr. G. Nazim Farzana. Congratulations, doctor.
Hello.
Yes, doctor.
Sir, this is Dr. Nazim. Actually, actually nice initiative from your side, sir. Congratulations to all of the organizers there.
Thank you, doctor. You can say where you are practicing, doctor. It will help us know more.
I did my PG at Stanley 3 years back, then finished my government bond posting, and at present working in a private hospital in Chennai, sir.
Very nice, doctor. Thank you for being here. Rank 11, over to Dr. Niranjan again to do the honors.
In 11th position, Dr. Abhishek. Could you please turn on your
hello.
Yes, doctor.
Yeah, good evening, sir. Good evening, ma'am. I am currently working as a senior resident in the Rohilkhand Medical College, Bareilly, from Uttar Pradesh.
Very nice.
Nice to have you, sir. Congrats.
Thank you, sir.
So on rank 10, Dr. Shruti, can you do the honors for rank 10?
On rank 10, we have Dr. Ravi Chandna. Congratulations, Dr. Ravi.
Thank you. Thank you to everybody. Thank you to all the organizers for this wonderful quiz. It was very efficient. I'm a fellow of cataract and medical retina at ASGI Hospital, Bhopal.
Oh, very nice, doctor. Thank you for taking your time. I think you are in practice now, and you have took your time to attend the event. It really means a lot. Thank you, doctor.
Thank you, sir. Thank you.
Next, we'll have Varsha to call out the rank 9.
Dr. Charu Malik. Congratulations, doctor. Can you unmute yourself?
Hi, thank you so much. Very good evening, everyone. I'm Dr. Charu. I'm from Delhi, and I'm working as a retina consultant at a private medical college in Noida.
Congratulations, ma'am.
Thank you. Many congratulations to the quiz masters also. It was a very well organized quiz. Thank you.
Thank you, doctor. It means a lot. Your feedback means a lot.
Thank you.
Next, we'll move to 8. Niranjan, please do the honors.
At 8, we have Dr. Saranya.
So good evening, sir and ma'am.
Yes,
I'm
yes,
Dr.
doctor.
Saranya from Pondicherry, sir. I've been working at a government hospital near Kadlo, sir.
Okay, okay. Thank you, doctor. Congrats to you once again.
Thank you, sir.
Next, we have Dr. Alice Thomas. Congratulations, Dr. Alice.
Thank you, ma'am. Thank you.
I think we're seeing you again, right, from last year. Yeah.
Again and again, 2 days and again, one more again. Yeah, Alice, you can tell about yourself once again for.
Sir, I did my PG from Agarwal Eye Institute in Chennai, and now right now I'm in Kerala. I'm working in a Little Flower Hospital.
Okay, very nice, doctor. Over to rank 6. Varsha, please do the honors.
Dr. Just Mary Santosh. Congratulations, doctor.
Hi, I did my PG from RIO Chennai. Now I'm doing my VR fellowship in Giridhara Institute, Cochin.
The next, I'll call upon Dr. Aparna KS for the 5th position. I hope we have not skipped anyone. Dr. Aparna, are you there, Dr. Aparna?
Yes, can you hear me?
Yes, madam, please.
I'm Dr. Aparna KS from Trivandrum. I completed my DNB from Chaitanya Eye Hospital, Trivandrum, and currently doing Orbit and Oculoplasty Fellowship at Aravind Eye Hospital, Tirunelveli.
Thank you, madam, for joining us on a Sunday evening and winning the 5th prize of our 25th year celebration. Thank you.
Last civil service in 5th position.
Thank you, madam. Thank you. And over to Dr. Niranjan, none other than Niranjan, to call out the 4th ranked person. I think Niranjan, over to you to do the honors.
It's a privilege to call out Dr. Prashop Mohan. And we have a very interesting thing that I wanted to mention here is both 4th and 5th are exactly 5 minutes, 54 seconds and 25 points. And I really wonder how the software decided 4 and 5. So I think we have to give it to both of them. And can we have Dr. Prashop on stage? Yes, sir.
Hello. Yeah, well, really enjoyed the quiz.
Sir, my apologies for 3 minutes delay, 7:33. I hope you have started the match.
I think match has started.
I hope I'm really sorry for that. I tried my best. 3 minutes, please do my apologies for that. Yeah.
No issues. I'm Dr. Prashop. By the way, I'm Dr. Prashop Mohan. I'm a cornea refractive and cataract consultant at Chaitanya Eye Hospital and Research Trivandrum. First of all, I will congratulate all of you. Really well organized, really well thought out, well conducted. Today, I know there are a lot of quizzes, left, right, and center. We have a lot of quizzes because online platforms are available. And the standard of quizzing has kind of come down. Because I'm a passionate quizzer, I'm really serious about quizzing. I think you have put in the, to create a quiz, it takes a lot of effort. And I think you have put in the effort and it is showing up. And it also pays to have young quiz masters. This is a message, if other seniors are listening, I hope they are. Young quiz masters, I think, is the key to go. This is the way to go. And they know what the pulse of how quizzing should be done and how quizzes should be conducted. I think Niranjan and Varsha did a fantastic job. And well done. Keep it up.
If I am not wrong,
it's an honor to share the 5th position with my former PG.
Very nice, sir. Actually, we have 2-3 mock trials before the event, sir. Well, that was one part of it. The other part of it is the brainstorming that we all brought it in, especially spearheaded by Niranjan. Myself, I'm more like representing a general audience, saying that this is more tougher, this is more easier, or the perspective. That's what I try to help them out. Shruti is another person, Varsha is another person. The team effort of all 4, we were able to compile the questions, and it really, as you rightly pointed out, the effort for the Capsule 1 and Capsule 2, I think it's all paying rich dividends to hear those kind words from you today. Thank you, sir.
Thank you, sir.
Thank you.
Thank you for all the feedback, sir. I'm once again sorry for the 4th minute delay, 7:34. Yeah, right, sir. Thank you, sir. So next, I'll introduce my good friend. We have been traveling for, again, just like Aarti, for the past 2 years, 1.5, 2 years in UC Forum. Dr. Kaushik Tripathi. And Kaushik, the stage is all yours. Please do say about the work that you are doing, the work that we are doing in UC, and we have a young crowd. We have still 42 participants. I think please do the honors of telling them about UC, and also we are all part of the executive board. Even Aarti is also part of the leadership group. I think this is a nice day where we can actually talk about the work that we are all doing so that we can motivate more people to know about YOSI. And over to you, Dr. Kaushik. And once again, congratulations for the third prize that you have won. And more than anything, your participation speaks a lot about the friendship that we share. Thanks a lot once again. Over to you.
Thank you, Dr. Prasanna and team. It was a wonderfully arranged quiz. Actually, specifically the last 10 questions were very nice, and the timing was important thing for that, and the associative power of your brain, and how fast you were. That was judged, and also the most of the questions are not direct. That is what was done here, and it is important because nowadays you can Google anything and you can know, yes, this is that. So that was the good thing about this quiz. And yes, Dr. Prasov has been quizzing for a long time, and yes, we do appreciate the efforts your team has done, and it is a very nice quiz, and we actually learned new things here. And about YOSI, I think every young ophthalmologist in India should be a part of it, and the process is very democratic, and if you want to get involved, you can go reach any heights within the organization. That is the best part of it. And we have multiple different areas where you can go and you can contribute, including like serve the anterior segment. There is YouTube, you can submit in YouTube channel. There is a medical legal group also, which is conducting a monthly webinars for all of them to increase the literacy regarding the medical legal cases. And we have your slides on which you can showcase your slides so that your slides are prominently seen in all the like online it is available, and also they have awards for best slides. Definitely if you join, there are multiple other benefits, including you can see what the fellowship opportunities, and also we do in slides we are having mentors who will guide you how to prepare a slide, and definitely they will help you improve on what you know. So definitely I will request all the people, and most important part is the charge is very low if you compare it with AIOS, which is around 6,000 to 10, I think 10,000 or something. The EOC is still 2,000 per joining fee. Dr. Arti, am I correct?
Yeah.
Very correct, sir. Very correct.
Arti, you can also add on after Kaushik if anything else that you want to add on. Yeah.
And also, I'll stage is all yours, Dr. Arti. She is a very dynamic person, and she has been leading EOC for a long time, and she is a growing factor. She does all the work, and she remains in the background. She helps all people to explore and give the best of themselves. That is the best thing about her.
She's like the Rancho of Three Idiots. She pushes everyone and takes the car and leaves.
Nothing like that. But the best part of YOSI is you get to know other YOs. So you get to know your peers. You get to know what is happening in other part of the country or other part of the world. So you don't want, even if you are not keen in doing that leadership in particular, you don't want to play a particular role, it will still benefit you in some or the other way. Correct. So I am sure Dr. Prasanna would have, you would have seen his growth yourself, and anyways he would have grown wherever he would have been, but then YOSI is really a place where each and every YO has to be there, and once you join, you will yourself enjoy the journey. I have been with YOSI for 3 years, and believe me, all these friends, Dr. Prasanna, Dr. Kaushik, I have met through YOSI.
Yeah, true. And for neophytes who are thinking what is YOSI, in Tamil Nadu we have this thing called think in Tamil is YOSI, the native language. So YOSI is YOSI, Young Ophthalmologists Society of India. And as my two good friends are here, and they're also winners today, Kaushik and Aarti, please do visit the Young Ophthalmic Society of India. You'll know about what it is and how it is.
Kind of ashamed to call myself a winner, Prasanna, at the 16th position.
No, we are all winners at the end of the day. Every participant is a winner. See, the idea of having this kind of event is breaking the ice, letting us know each other. I was very particular about when I told to Niranjan, I told about the interaction with the 25 people should be more. We knowing each other, it matters. Otherwise, we just give a prize and we don't know who won, what was there, where are they from. That's the main USP of this event. And we did try to start on time and finish on time. I think 10 minutes here and there, our fellow participants will agree. And still we have 37 plus participants who are still logged in, because they feel there is something more that they feel that they are getting from us. And I'm really humbled and honored for all the participants who are still here. I think we need to thank them for that. And thank you guys. Thank you, Kaushik. Thank you, Aarti. And we'll just move forward to the second position person, and we'll make sure we'll give them even more time, and they can also share about their views, their ideas, their ambitions. The stage is all yours. Niranjan, please do call the person who is ranked second, and let us hear from them also.
We have Dr. Jayashree P. Can we have you on screen, ma'am?
Dr. Jayashree, the stage is all yours. Do share about where are you, what is your ambition, what is your vision and mission for ophthalmology. We would like to hear about you, more about you, and this is a very informal one. I hope you are not a cricket lover. If so, the stage is all yours. Yeah.
Hi, sir. Thank you so much. Actually, it was an honor to meet you. I was in IGMC for some time. You've come to IGMC Puducherry before this election. And it was so nice to see some of your innovations directly. And we sincerely look forward for many of it in your YouTube platform and all that. And currently, I'm working as senior resident in JIPMA. And I am interested in glaucoma. I wish to do a glaucoma fellowship.
Sure. Very nice, very nice. And you want to say more about your vision or mission? What is that more passionate about? Glaucoma surgery or clinics? What is that you really mattered for you to take up glaucoma?
Yeah, glaucoma, both medical management and surgical. I'm very much interested in glaucoma, especially tube surgeries. That was my thesis topic also. So.
Yeah, so you would have heard about YOSI, right? The Young Ophthalmic Society of India. That is what we were currently talking about. I think Kaushik and Aarti can please do the honors. The group is there. There are so many people who are still there in the group. I think we can. This is it's a family event, is what I would like to call it. So there is no restriction as such to post something in the group or not. I think everyone will benefit from that. So thank you, Doctor, once again, Dr. Jayashree. If you have, if you don't have any more things to add for us, with your permission, can we move to the number one winner?
Yes, sir.
Who's been waiting very patiently. And I would like Dr. Shruti to call the number one person who came. So our own,
Sure. So I think we have our winner, Dr. Mary Stephen. Congratulations once again. We saw you in the beginning.
Thank you, ma'am. Thank you.
Yes. Sorry. First, my apologies, sir. I think I know you are a staunch cricket fan.
No, sir.
Yeah. So, my apologies for the 13-minute delay. But the stage is all yours, and we would. There are still 35 participants who are still here, and we would want to hear from you, sir. So you are, I think, winning Kaushik. Kaushik is a beast when it comes to quiz. Kaushik, Niranjan, Prashov Mohan sir, even Aarti is being very humble. Aarti also has a great sense of knowledge and she is very good. And there are so many other people, even Jayashree, all the other people who are still here. And I think winning against Kaushik, Prashov sir and all is not, every day it's not going to happen. I think you must be on cloud 9, and I think you can give us a treat also, if possible, with the, so please do share your experience, sir, and where are you and what is your ambition and goals?
Sure, sir. I did my post-graduation from JIPMA Puducherry, and I worked for some time in private medical college. Now I'm working here as in JIPMA again as senior resident. So I have met you in Venkateshwara Medical College, sir. Once,
yes, sir. I know, sir. We came with Aji.
Yes,
yeah, correct.
Yes, sir. Yes, sir. Actually, as you said, Kaushik sir and Prashov Mohan sir, whichever quiz I am participating, I see both their names on the top always. Currently, also this DAS quiz series is going on. Every month quiz, I'll see sir's name on first 2 ranks, might be, and some 5th or 6th maybe. Okay, so it's good to get some few marks ahead of Kaushik sir as well as Prashov Mohan sir. It's really an honor. And the quiz is very well conducted, sir, I should say. The questions are really standard. And most of the time, the questions will be quite simple. But the quiz is very well conducted, sir. It's like really a kudos to the team which has been organized the same.
Thank you, sir. Thank you, sir. So your vision and mission, anything else that you want to share with us?
I'm also interested in glaucoma, sir, because of my thesis topic and my mentor, Dr. Subhashini ma'am. She was the professor and former HOD in Jubilee. So ma'am was the one who motivated me, so that I'm just trying to follow the path of ma'am by taking glaucoma fellowship, sir.
Sure, sir. Sure, sir. I think Aarti is also taking notes. Kaushik is also taking notes. We all want you guys to be on the board of YOSI, because people like you would feel the YOSI is, that's what I told, the Young Ophthalmic Society of India. We would all like to have you on board. So I take the honor of saying that we don't have any disclosures or anything. It's just that we all can learn from each other and grow together. So that's the only agenda. So thank you, sir. Thank you for being here on a Sunday evening on an India-Pakistan match. For all the participants, 33 participants who are still here at this moment, it really means a lot. And the vote of thanks will be done by the chairman of Mahathma, Dr. Ramesh and Dr. Meena ma'am. Over to you. There are still 33 participants who want to hear from you. And please do the honors of vote of thanks.
Prasanna, sorry for the interruption. I have shared the link to join YOSI. Maybe you can put it in the group for their benefit, if in case they are.
Sure. We'll make sure we'll do it. The group is still active. Not, if I'm not wrong, not many have left. So we'll do our best. Yeah. Yeah. Over to Dr. Ramesh sir and Meena ma'am for the vote of thanks.
Hello, young ophthalmologists. Immense pleasure in witnessing and visualizing tremendous academic growth among the young ophthalmologists. And this academic feast, it was really a feast to watch, witness, to experience and to enjoy. And I like to congratulate organizers, Dr. Prasanna Venkatesh and Dr. Shruti Vaishali, on behalf of Mahathma Hospital, and Dr. Niranjan and Dr. Varsha as well, and all the participants and all the winners. A hearty congratulations to all of you, and looking forward to similar academic feast in future, which would link all the young ophthalmologists in similar forum. Thank you. And wishing you all the best. Thank you.
Thank you, madam. Thank you. Ramesh sir, any concluding comments for the event? Yeah.
Yeah, I was also seeing young talents like our home team. Varsha, first time I'm seeing her on such a program. As you rightly said, these sort of programs brings out the best in one's capabilities to perform well. Good, Varsha. Like Niranjan, I already saw in the last program. Last program. So good. Like I'm also getting used to a lot of younger faces. So hopefully it should be a good learning experience for me also. Great, guys. Yeah.
Thank you for the wonderful words and the prize money award. The winners, please do be in loop. We'll be getting to you shortly. Niranjan and myself, along with Varsha and Vaishali, we'll make sure we do it as swift as possible. And the next set of instructions will be coming from myself or Dr. Niranjan. And thank you all. And we'll get back to you with the next date for Capsule 3. We plan it to have it as 12 sessions of celebrating 25 years. And at this time, I should really congratulate Niranjan for all his efforts. He's a very young ophthalmologist. He's trying to find his space in his fellowship. Despite fellowship, I know how tough fellowship will take on your mind and body. But he's here with us today. Even a Sunday, he's willing to spend on a very noble event. And he's really doing a great job guiding me, guiding Varsha, and even others as to how things has to be set in place. And even Dr. Shruti, who's also equally brilliant. She's our international quizzer who was there last capsule. And she's also mentoring a lot of different kind of questions. And with the feedback that we are getting, it really motivates us to keep doing more and more with the wonderful content. So the right content or good content is what I would like to label, and we promise or assure you that we will definitely deliver good content, and we will get back to you with the winners, the 25 winners, and how you will be receiving your award. And thank you, Niranjan. Thank you, Dr. Varsha. Thank you, Vaishali. And over to you three. If you have any closing statements, I think 45 for no loss is the score. There is still not a wicket drop, I feel. I think before anything happens, we can close the event.
On a closing note, thank you everybody for participating in our second capsule. And I hope, the most important is that you've all enjoyed the quiz. And secondly, I would request that you keep quizzing, keep quizzing, keep at it, keep participating in all the quizzes that come your way. Please inform your friends, bring them into quizzing, because this is one fun way of learning. Ultimately, what we take back home is not just the prizes, it's about the amount of knowledge. So that should be the goal. And I request all of you to inform, bring along with you more people, maybe a couple of your friends, and we can make it a bigger event in the next one. So with that, I would like to thank Prasanna sir and the entire Mahathma team for giving me the opportunity. And I think with that, I would like to close it.
Thank you. Shruti, over to you.
I think we'll have the quizmasters, Dr. Varsha, also give her ending statement. I was happy to see her initiated as a quizmaster here. It was amazing. Yeah.
Thank you so much, ma'am. Thank you, sir. Prasanna sir. I think he motivated me so much. He literally is trying to push me out of my comfort zone. This is my first time doing a quiz. So thank you so much for giving me this opportunity. Thank you, Ramesh sir, and thank you, ma'am. And Dr. Niranjan also has helped me a lot in this journey, quizzing journey. So this has been a very great experience, and thank you all the participants for having participated in this quiz. Hope to see you all in the next capsule as well. Thank you.
Shruti, anything else from you?
See, we have brilliant quizmasters and brilliant participants, so it's very exciting. Hopefully this continues, it grows. Hopefully the number of participants grows every time. Yeah.
I think we still have 22 participants. That itself really matters a lot. Really, thank you guys. Thank you from the bottom of my heart. I really congratulate each and every one of you. And all of you who are fans of cricket, I'll not hold you anymore. Please do enjoy the match, and let us hope India wins today. Thank you. With that note, we'll all sign off from you. Until next time for the Capsule 3. And for the winners, we'll be getting back to you shortly after the event, after we log out. Thank you, dear all. Thank you. See you all until next time for Capsule 3. Thank you. Bye.
Bye. Thank you, everyone.
Bye.
Thank you, sir.
Yeah.
Thank you, sir.